So good morning, all of you. A warm welcome to all our students from various parts of the country. On our registration, we have close to about 387. I'm sure a lot of students will be joining us shortly. Some may be facing some issues, but we look forward to having all of them very soon. Let me take this opportunity of introducing all the speakers for today's session. I start with myself. My name is Srinivas Shinde, and I'm the Chief Marketing Officer for Dayanand Sagar University, with almost 25 years of rich industry experience, both in the higher education side, in the edutech space. I would hereby like to take the opportunity of welcoming our Honorable Vice Chancellor, Dr. K.N.B. Murthy. Next, we have Dr. Pushpa Sarkar. She is the Dean for School of Allied Health Sciences at Dayanand Sagar University. She comes with a rich experience of over 2 decades. I also take the opportunity of welcoming Dr. Uma Shankar. He is the principal of Padma Shri School of Public Health. I next take the opportunity of welcoming Dr. Prashant Kumar, who is the professor and the head of department for Department of Physiology at C.D. Seimer, which is the medical and research institution of Dayanand Sagar University. I also take the opportunity to welcome Professor Savita Ravindra. She is the head of department of Physiotherapy for Ramaya Medical College and Hospital, and also she's the Dean of Faculty for Applied Health Sciences, for Allied Health Sciences and Physiotherapy at Rajiv Gandhi University of Health Sciences. A warm welcome to you, ma'am. I also take the opportunity of welcoming Dr. Shilpa HD. She is the professor and the head of department for biochemistry at C.D. Seimer. So warm welcome to all of you. This is going to be the schedule for today, for the next 2 hours. Post the introduction from my side, we'll have the Honorable Vice Chancellor, Dr. K.N.B. Murthy, setting the context and sharing his views on the new age programs available under the Allied Health Sciences, the kind of career option for students, the kind of internship options for students, the kind of options available for higher studies. Post that, we'll have Dr. Pushpa Sarkar, Dean for the Allied Health Sciences, who will be talking about the career opportunities in this sector, followed by Professor Savita Ravindra, who will talk about the career in physiotherapy and the way forward. Post that, we'll have Dr. Shilpa HD, who will talk about careers in medical laboratory technology. Speaker number 5 for the day will be Dr. Uma Shankar S, who will talk about careers in public health. And speaker number 6 for the day will be Dr. Prashant Kumar, who will talk about anesthesia and operation theatre technology. Post that, we'll have all the questions taken. At any point of time, any student would have any queries, they can always use the chat option and they can key in their questions. Otherwise, I would request all the students to keep their mics on mute in the interest of not to disturb the entire session. And post the question answers, we'll have the sum up session done by our Dean, Dr. Pushpa Sarkar. So I would hereby like to invite our Honorable Vice Chancellor for Dayanand Sagar University, Professor Dr. K.N.B. Murthy. Over to you, sir.
Thank you, Ms. Shinde. Good morning, respected co-panelists, my dear students, parents, and other invitees who have joined in this panel discussion or webinar. I'm extremely happy that Dayanand Sagar University is organizing webinars on career opportunities in allied health sciences and the way forward. Or we have been doing it for various programs of study so that students have the information and also all the requisite inputs for making an informed choice. I thank the organizers for giving me this opportunity to be with all of you this morning. I would like to begin by stating that we are in a situation right now, a pandemic situation, which has started last year, and we could overcome the first wave. Now we are in the second wave. The second wave appears to be little harsh than the first one. However, the governments have been doing their best to keep everything under control. I am also given to understand that this uncertainty condition, the complex situation condition, would continue for next 6 to 12 months. Most probably, the things may come under control after the complete vaccination has been done, and all of us are aware that this is a global phenomenon, not confined to our country alone. Of course, our country kind of situation is far different from all the other countries, particularly the vast population, the kind of the healthy infrastructure that we have, and I'm sure in the next few months we should be overcoming this situation. And two, three things are becoming more evident now. One, the humankind has never felt more vulnerable, unsure, incompetent to this extent ever before across the globe. Across the globe. That's one thing which is exposed. The second thing that became evident is that the skills, the knowledge, the experience of people and institutions have become more or less irrelevant and inconsequential under most domains to handle this pandemic situation. What does it mean? It basically means that there's a growing demand for new skill sets, new knowledge, new types of interpreting the acquired knowledge. It clearly means that going forward, the kind of thing that we're going to do must be far different from what we were doing in the past. And when these things are going to be there, I think all of us agree that the life should go on and we need to move on with our future plans, and we also need to move on with our educational pursuits as well, because nothing can come to halt. Whatever be the kind of conditions, we need to overcome them and move forward. Therefore, with that kind of a background in mind, I would like to mention that you're all aware that the examinations, the plus two examinations, the 10th examination are all postponed because of the situation in the country. However, the same thing has happened across the globe. Whatever I'm saying is for the globe as well, for all the countries. Therefore, there's some kind of uncertainty, some kind of confusion with regard to the board exams. and how do we go about it, what's going to happen, and things are tight. I'm sure this particular webinar or the panel discussion is to give you some inputs, how to go about it, and what kind of careers can be chosen. And we would like to present a picture which would make you to make an informed choice. I'm sure the board exams would happen in the next 2 to 3 months. It may be delayed, but definitely they could happen. Then the examinations will also be followed by the entrance examination for joining a professional course, and ultimately we have to plan for taking the careers forward. While that being the scenario, we would like to see the kind of things that are going to be there going forward. There are several progressive organizations, which we normally call as proactive organizations, like the World Economic Forum, the World Business Council for Sustainable Development. These are organizations which are credible. They keep making predictions. They keep mentioning what are the areas in which the jobs are going to be created, the opportunities are going to be present going forward. I'm extremely happy to inform that these organizations have made about 3 important predictions. One prediction is going forward, there'll be rapid technology evolution in all domains, in all walks of life. In all walks of life, like the transport, the health sector, the agriculture, everywhere there's a use of technology. That's one thing that's going to happen. The second thing that's going to happen is the workforce, the people who are going to work in organizations will have a lot more expectations. They start telling this is the kind of environment that we need for working. There's a second change that's going to happen. The third is socio-economic polarization. Socio-economic polarization in terms of the income inequality, all those things have to go. That's the other area where the urbanization, etc. These kinds of issues are going to be the 3 important things that are going to happen. The next prediction that's also been made is that majority of the jobs that we see today, the kind of work that we see today, will vanish in next 5 to 10 years. 65% of the jobs will vanish. New kind of jobs are going to come. Coming to the healthcare sector, it's been indicated that there'll be a growing demand. There's a market demand as for this particular domain is concerned. It appears the market of allied health sciences will be, which is around $193.83 billion in 2020. It will become about $372 billion in 2022. In the next 2 years of time, there's a phenomenal growth in the health sector. There's a market demand is going to be much high. Whenever there's a market demand is going to be high, the opportunities are also going to be very high. There's one prediction that we made. The second prediction that's been made is the number of medical doctors, which was around 8,27,000 in this country in 2010. Now it has become 12,55,000. That's the kind of growth that's happened. About 50% growth in the last 10 years. It will continue to grow in the next 3 to 5 years. Next, the kind of requirements that are there is about 3 million beds are required to reach a target of 3 beds for every 1,000 people. That's the kind of requirement that's there in the global kind of scenario. It also appears that additionally 1.5 million doctors and 2.4 million nurses would be required by 2025. That's the estimation. That's the kind of job potential that's going to be there. It's also been mentioned that the going forward, there are a lot of changes that are going to happen. What are those changes? A digital healthcare is going to be the way forward. Means there'll be a lot of computerization. What are those domains? The domains are virtual critical care. Means there'll be some monitoring virtually. They may not be physically present, but virtual monitoring is one. Next, Internet of Medical Things is the other area. The third one is electronic medical records, where a person can look at the record of a patient from anywhere in the world. Then home healthcare centers are going to become order of the day. We already started seeing each and every home will have some kind of healthcare, and there'll be robotic systems that are going to be dominating in the healthcare sector. All that I'm trying to suggest is that there's a growing potential in this area, and there are lots of courses which are going to be designed and offered in the future. And it appears there are 4 or 5 areas or domains in which a lot of opportunities are going to be there in the next 5 to 10 years. Apart from the technology like AI, machine learning, and etc., it appears providing food for the growing population is going to be one area where a lot of opportunities are going to be there. The second one is healthcare. Healthcare is the other area. The third one is the connectivity. The connectivity is going to become the key going forward. And the next one is the computing power, because whatever the thing that's happening in the pandemic situation, now a lot of work is being carried out. How did this virus come in? And how did this virus taking different shapes, different forms? That's a mutation, that's what we call. And digital twin, finance, privacy issue, climate change, faster construction technology. These are the areas where a lot of job opportunities are going to be created. And I'm sure the panel would tell you the kind of opportunities that are there in the allied health sciences, so that the the people who are joined, the students who are joined on this webinar would get a fair idea of the opportunities in allied health sciences, and particularly the courses that are being offered by Dayanand Sagar University. And I'm extremely happy to inform Dayanand Sagar University is a university with a difference, is a university which is proactive, is a university which considers several inputs from the proactive organizations to bring in the changes in the entire gamut of higher education. I'm extremely happy that the faculty of Dayanand Sagar University are well aware of the requirements of the future and prepare the students for that kind of requirements. I can say for sure that Dayanand Sagar University is going to make best efforts to provide high quality education and meaningful education for a, a long-term career for all its students. I take this opportunity to thank all of you, and also thank the organizers for providing this opportunity to set the context for this webinar. I hand over to Ms. Sinde to take it forward. Thank you. Thank you very much.
Thank you so much, sir, for setting the context. Students being at home and with examinations clarity not available, they are very confused when it comes to looking at their career choices. And this being a very focused and a very niche area, it's always good to bring out the details of such kind of programs that are available to students, so that students can utilize this particular time that is available before they set in for the board exams to go ahead and decide in terms of what could be their career choices. So thank you so much, sir. I would now like to request the Dean for Allied Health Sciences at Dayanand Sagar University, Dr. Pushpa Sarkar, to please give her views in terms of the kind of career opportunities available to students, the kind of job opportunities, the kind of opportunities that they can get when it comes to higher studies or when they go for PG programs. So over to Dr. Pushpa Sarkar. I'll do this.
Yeah.
Over to ma'am. Yeah, I'll have your presentation ready.
I will request you, Mr. Shinde, when I need that.
Yes, yes.
Thank you, Mr. Shinde. Honorable Vice Chancellor, the distinguished co-speakers, Mrs. Shinde, and my dear students. Now you're all here, the young minds with a lot of dreams. Now you've taken up the science stream. Most of you having something in your mind, a focus. Now this particular COVID-19 pandemic is creating a havoc, and all of you know the aftermath of this. And now you know the importance of the healthcare too, a service to the needy, the humane approach. Now to be in the medical field, you need not be a doctor. Now all of you may aspire, but you all know that each one of you can not be a doctor. Hence, now to be in the medical field, you need not be a doctor. Today, that's why we are here to discuss the alternate courses where you can still be an integral part of the medical team serving the mankind. Now, you know that the world is a global village. Now, why do you say that? The various factors contributing could be communication, travel, and many more. The most important being great innovation in technology. This technology has seeped deeply into the healthcare sector. Now, the healthcare sector is one of the rapidly growing industries, and as you know, India is leaping towards the advance in the healthcare, and it's becoming a healthcare hub. Now, we know that during this pandemic, we have seen the doctors, the nurses, and healthcare workers, they have been relentlessly working, putting their lives at risk, putting their families behind. And this pandemic has brought to light their incredible commitment and courage and their service. But the pandemic has also exposed the weakness in our health systems. And thereby there is enormous pressure on the existing health workers. Now today, India is facing an acute shortage of skilled manpower, and this is coupled with other related factors. Now this is what is making the healthcare system is unable to meet the health needs of the population. Next slide, please. Now, what has happened? Why is this? Is because the health workforce in Indian scenario has been defined with a focus mainly on doctors, nurses, and few others. Very little has been done to estimate the need and also to identify the competency of the healthcare providers who are other than doctors and nurses. Now, there are many other professionals belonging to more than 50 healthcare professions that continue to remain underutilized and unregulated also in the health system. Now, with the advancement of the health sector, the need is now to create a fresh vision of healthcare delivery with a patient-centric approach, what the patient needs, how it has to be done, and focusing on a multidisciplinary team. It need not be only a doctor assisted by doctors or doctor with nurses. There will be others too, the other healthcare workers too, to form a multidisciplinary team who can tend to the patient so that the load or the burden is not much only on the doctors and nurses. Now, the COVID-19 pandemic is a stark reminder for the need to implement the new ways of deploying the health workers and improving the access to the quality services through qualified and competent allied and healthcare professionals. Next slide, please. Now, who are these allied and healthcare professionals? Now, who are they? Now, allied health professionals, they play a critical role. They're the support pillars of the healthcare system. Now, they belong to a broad group of professional categories where I put in a slide, there may be a physiotherapist, an occupational therapist, or they be serving the ophthalmic sciences, or they belong to nutrition sciences, medical laboratory technicians, the radiology technicians where you have maybe X-ray technology, or one who are operating the CT machines, MRI machines, and even giving radiotherapy to the cancer patients. Now you have physician assistants. When there's a load for the doctors, they do need assistants who can take some burden of their work. Then community care, where you have this public health officials who can go and help out in the public, work in the public, and surgery-related technologies like anesthesia technicians, OT technicians, and many, many more of these. Now, what do? Now, they're involved in the delivery of health and also health-related services, sometimes even for the treatment part, for the diagnostic part, and even to prevent certain diseases. And post that, if you see the physiotherapy, most of you may be knowing the rehabilitative interventions also, that the post-treatment. Now, they work in interdisciplinary teams, including doctors, nurses, public health officials. They promote health, they protect the patients. In case they come with disease, they treat, they help with the treatment, and also to manage person's overall health. Now, if you see that this allied health professionals, if at all they are empowered, they can be leaders of change. There is an ample international evidence. There are studies on this suggesting that these empowered health professionals, they can be leaders, they can play a critical role in improving the reach of health services, to deliver the health services, the reach to the needy. Okay. Now, in conclusion, what we can say now is, due to the ever-increasing burden, the disease burden on the society, there's a scarcity of the medical doctors, and due to the critical role which is played by the allied health professionals in today's healthcare delivery system, it is necessary to build capacity among these professionals and ensure that they are appropriately skilled. Now, the education and training imparted to those undertaking these professions were not regulated all these days in India. There was no regulations, there were no guidelines, and these professionals were not even registered with any regulatory body. They are not registered practitioners as such. Now, before I was a dean in Dayanand Sagar University, I have served as a dean of Government Medical College at Mandya, and also the director at Rajiv Gandhi University of Health Sciences. Now here under Rajiv Gandhi University, I have seen so many affiliated institutions not having necessary infrastructure, not having necessary staff, faculty in them, and not even having an attached hospital delivering these courses. Now we need to make it strong. We need to make it, deliver a skill-oriented training for these students who take up these courses. Now, what has happened now is the National Commission for Allied and Healthcare Professions Bill. Okay, this has been cleared in the Rajya Sabha and also in the Parliament. Okay, so the Nchp Act, that is National Commission for Allied and Healthcare Professions Act 2021, has been approved by the Honorable President of India on 28th March of 2021. Now, this provides a regulation, maintenance of the standards of education, and also it also regulates and maintains the services which are rendered by these allied and healthcare professionals. And this was very important. We needed that. Now, henceforth, whoever takes up this professional will be registered with the respective states, respective state councils, and they'll be called as a registered allied healthcare practitioner. Like medical, when you register, they're called registered medical practitioners, the doctors. Likewise, these professionals will be called as the registered allied and healthcare practitioners. Now, when we talk about these allied health science courses, as I said, there are more than, now the government of India has lifted 53 of these courses under this particular bill. And in broadly, if I want to talk about this, the Bachelor of Science, it's called Bachelor of Science in Allied Health Sciences. This is a 4-year graduate program where 3 years you are into the study and you have 1 year of internship where you're rigorously trained. Now the courses provide a broad-based foundation in global and, am I audible? Hello? Am I audible?
Yes, madam. Yes, madam. Yes, yes.
Now, these courses, they provide a broad-based foundation in the global and national healthcare issues and ethical and legal issues, health promotion, disease prevention, then evidence-based practice, then even the research. This will promote research also, and the healthcare system management and healthcare-based informatics. It provides a broad-based foundation for all of these. So it will be a pillars of support to the healthcare system. Now there will be an integral part after post, training. There will be an integral part of the medical team which will be enabled to assist these professionals will be enabled to assist confidently in the technology-driven medical procedures. As you know, you need these people to get into the technology because most of the procedures are technology-driven as of now. In this 4-year course, I want to highlight that in the first 3 years, where in the first year, you get to study the anatomy. Anatomy is what? That is the study of the internal and external structures of the body and their disposition. Where's your heart? Where's your kidney? Where's your lungs? How are they connected? What are the veins? What are the arteries? And all these things. Now in physiology, the other subject, you study the functions of these structures. How do they function? What do they do? And when you come to biochemistry, now you study the chemical processes within the body. That is, the processes which are happening in the cellular level, right? Then you also study pathology, where the study of the causes and effects of the disease or the injury. That's why physiology is in health, pathology is in disease. You usually study the structural and functional changes produced by these diseases. Now, you also, the other subject in the first year would be microbiology, where you study the microscopic organisms such as bacteria, viruses, fungi, and so on and so forth. Does it click in your mind when you talk about viruses? We have this COVID-19 virus, we had the Sark virus, the Nipah virus, which was dismal to Kerala some time back. And now you have the coronavirus hitting all of us. That's so important. Now, all these you're going to study in the first year, basically. Now, if you observe this, you're going to study the same things what a medical student is also studying. So you all have the knowledge, a basic knowledge of the basic sciences as a medical student. Now, what do you do after this in the second and third year? When you go to the second and third year, you take up your specialty. You study in detail of your specialty. For example, if you take up renal dialysis, you will study more about the anatomy of your kidney, how the kidney functions, what are the disease of the kidney, how you can go about, what are the tests done to identify the kidney disease, to diagnose, and how to manage. And then renal dialysis being a part of this in the renal failure, you will study about how to do this, the dialysis program. And you also study about the machine learning here, about the dialysis machines, how they function, how to operate these machines, and how to manage these patients. Now, as you know, like most of the patients with diabetes, and many of them, most of them end up with this kidney diseases, like, most of them requiring this renal dialysis. And the surge is so much, we need more and more of these technicians, because the doctors are not enough. Like, they cannot stand there and do the procedure. Neither can the nurses do this. So this is what do you do in the second and third year, where you're trained the complete skills of how to manage the patient as well as how to manage the machine also. If you take up, for example, optometry, you're going to learn about the more in detail about the eyes, the socket, disease of the eye, how to measure the pressure in the eyes, about the all your long sights, what you call the myopia, hypermetropia, and things like that. How to measure it, how to you can even prescription for glasses also for the, and about the lens, the contact lens, all these things. Likewise, each takes up in each course you select, you will be specializing in the second and third year in those courses. In depth, you're going to study in depth about those courses, and you'll be trained. Once you're done, you'll be trained in how to deal with such patients who require the care of such professions. Now, when it comes to internship, after the 3 years course, when it comes to internship, now you will be literally practicing in the hospital in these departments where it is required. As you will be assisting the doctors, you'll be assisting the nurses, and you will be actually practicing your particular profession in the hospital. That is why I always stress these courses to be imparted in a huge hospital or in a medical college attached hospital, I mean a teaching hospital, because you can see all the equipments. You can see so many equipments, costly equipments, which cost around 1 crore and 60-70 lakhs. These are the equipments which can be afforded by a very huge setup of the hospital or in a medical college teaching hospital. And you have doctors along with you, so many doctors and others, your seniors, like, guiding you, teaching you through your course. And also the second thing is the patient load. You're exposed to so many patients. The patient input is so high in a medical college teaching hospital. That's why I personally feel that whoever wants to take up these courses to deliver health to the public need to be trained in a proper setup where you have all the gadgets, all the teaching faculty, and you know that in these institutions, the same teachers who are teaching the medical students will also be teaching to you. So you know the quality of teaching. This is it, the importance of this. Now, without going into much, I also would very broadly tell you where the employment areas would be for these professions. Now, as estimated by WHO, by the year 2030, it is projected to create around 40 million new health sector jobs. They say maybe it is in the developed countries. The economy of the developed countries would create so much. Maybe in the developing countries, it may be a little lesser than this. But around the world, it is so much. And even with this, there will be still dearth of the professionals to maintain or to fill up the gap of the dearth of the healthcare professionals. So there is no dearth in getting a job. If you're good enough, you're trained enough, there's always open. You can just see the enormous amount of these health sector jobs which will be created. Now, in broad view, I could say, if you're interested, you can do your post-graduation, you can do your research, and you can be employed in colleges and universities if you want to teach and impart your education to the students, to lead them, to guide them, or you can work in the hospitals rendering services. You can have private clinics. They have a small setup of laboratory or diagnostic centers where they're tendering this diagnosis investigations and radiological investigations too. Then research organization you would want to work. In transcription firms, you're welcome. In the industries, if you see the medical research organization, you see the research is that this is an breakthrough in the technology and science, because Earlier, a vaccine to develop would take a minimum of 7 to 8 years by the time it would release to the public. That much. Now, because of the technology available and all the other things, you have seen this COVID vaccine has come out in a year's time. That is where the research plays an important role, where more and more people can get into research. Like, more and more of this could help the mankind in all the other ways too, for the medicines as well as all these vaccines and so on and so forth. In the industries also, where the vaccines are produced, you can see we have limited number of pharma companies, limited number of industries. There are more manpower, definitely there would have been more industries supplying, catering to the need of the public or the patients. And you're welcome in the national programs also. We are going to take up public health. Now, this is I'm speaking broadly, and we have the other speakers will throw light on a particular course to all of you. So I once again thank Mr. Shinde to have given this opportunity to address the students, and also I would wish the students to be attentive to the other speakers, and definitely you will go back home sometimes being very clear in your mind what you're going to do. Sometimes you will be opting which course you should be taking to. So I wish this webinar all success and it would serve its purpose. Thank you all.
Thank you so much, Dr. Pushpa Sarkar. We now move on to the next speaker of the day. I would like to request Professor Savita Ravindra. She is the head of Department of Physiotherapy at MS Ramaya Medical College and Hospital. Over to you, madam.
Can I have the slide on, Mr. Shinde?
Yes, ma'am. Sure. Just a second, ma'am.
Yeah.
Ma'am, your slides are with you, I think, because it's not reached me.
Yeah, it has. I've sent it last night, sir.
You sent it last night, ma'am?
Yeah.
Just a second. Let me just quickly get it up because I don't see. Just a second, ma'am. Ma'am, your slides have not reached me. You can present it from your side if you have it, or you could send it to me quickly. I'll put it across.
Yeah, I'll just do it.
Sure. You want the screen sharing option? You already have it.
And do I have it?
Yes, please.
I can resend it to you because it's gone to you last evening.
Sure, you can send it to me.
Just now? Okay.
Yeah.
I sent it to you just now.
Just let me receive it. Yeah, I just received it. I'm just putting it across.
Okay.
Are you able to see it, ma'am?
Yeah, I think so.
Yeah, please go ahead.
Yes. A moment. Good morning, everybody, and I'd like to acknowledge the initiative of the Dayanand Sagar University, the Vice Chancellor in particular, Dr. Pushpa Sarkar. Today I'm just going to share a couple of details of looking at a career pathway in physiotherapy. And the little jigsaw that I have on the screen is more like saying, here's what are all possible things that a physical therapy professional would do when they graduate out from an undergraduate program in physiotherapy. Can I have the next slide, please?
Yes, ma'am.
So today I'm going to flow the couple of slides with sharing with all of you. First, just one slide to say really what are the scope of practice from a physiotherapy perspective. In India, what is the education looking like? What are higher education options? And what are the career pathways in a very simple and broad way in area of physiotherapy? The next one. So to put it in a very broad idea, physiotherapy professionals are the experts of movement science. These are healthcare professionals who diagnose and treat patients of all age groups. And you can see that we have one of our colleagues working with pediatrics, we have them in sports, we have them with other issues, adolescents. So all age groups with health-related problems, which result in limiting their ability to move and do activities that they would like to do in your daily life or routine. Can I have the next one, please? So within an Indian context, how does one go through for a physical therapy education? It's a 4.5-year degree program all across India. And after you have completed your 12th grade with science, 4 years of the you train in almost all the areas that a physiotherapy professional will work. And therefore, I say this sentence that the clinical training or the clinical education is at the core of the learning. Because when you graduate out, that is the domain that you will practice in. So, clinical exposure in your education is extremely critical to become a very successful practitioner. One can go further and within an Indian context, look at a master's degree in physiotherapy. That's a 2-year program. But people then at master's start to specialize, and there are many branches. People may choose orthopedics, they can choose pediatrics, neurology. Sports is one big area that a lot of people are opting to specialize. And for a lot of the games, you will see often when players in the game are injured. So there's that on-field sports training, there's an off-field sports training, and cardiopulmonary. So these are just to name a few. There are quite a few others. There's women's health. There is working with the older person. So there are many branches that one can choose to specialize in any one of them. Can I have the next slide? So what are the career pathways within for a physical therapist? The big chunk of work within physical therapy profession is clinical practice. That means you graduate out and you become a practicing physical therapy professional. You can set up your own outpatient clinic. You may set it up along with a group of doctors and run your own practice. You may work in a very large hospital setting where you work in inpatient and outpatient work. You may work at the current trend is to set up very massive rehabilitation centers and you work in a team there. You may work in home care services. Clinically, you may work or tie yourself, work up in case of sports, clinically with sports clubs, with sports organizations, so be it football, be it tennis, be it cricket, You may work with the local club, with the state level clubs, with the national clubs. And as a clinical practitioner, you can start practicing within the law of the land after getting a bachelor's degree. Can I have the next slide, please? Can I have the next slide, please?
Yeah, ma'am, just 1 second. Yeah.
So the second pathway that people could opt for is they may want to come back and work a bit in clinical practice, but also be associated with academia. When I say academia, you may have an interest in teaching and research. So you may want to join an academic institution which has clinical but also academics. You may choose to do a faculty position in an undergraduate and a postgraduate program in physiotherapy, for which you will need a minimum qualification of the master's, but a PhD would become more desirable. So if you decide that is a pathway you want to go, then a master's or a doctorate degree is something that you will require. There are a lot of people who, when they graduate out or while doing their master's, develop an interest in wanting to follow the research pathway. And then that pathway could be in basic science areas, but it is also, there are lots of funded research programs that happen, that they take research assistants and people develop a career of their own going down the research pathway. So that's also another option that's available within the context of a physiotherapy professional. Can I have the next slide, please? Opportunities beyond is what I call. One of the things that is very current within physiotherapy practice in India is we have a very big consortium called the World Physical Therapy Body, and about 120 countries around the world are networked inside the body. What we've done across the globe is the undergraduate bachelor in physiotherapy program has got a recognition across the globe from one country to another. So what is the advantage of something like that? You can go in for a higher education, be it a master's or doctoral programs, because the bachelor's degree is recognized and considered as being equivalent. So that's why I've put that in saying equivalence of the undergraduate degree exists across, be it North America, be it Europe, be it United Kingdom, be it any of these countries. Yes, but if you decide you want to go out there and you want to work over there, then each of the countries have their own licensing exams for which you'll have to apply, you'll have to qualify, and then you'll be getting a license to work and you'll be able to. But the advantage is that because the undergraduate program has an equivalency, that's a pathway that there are some people who opt for. Can I have the next one, please? So in conclusion, I want to say that it is a career option that allows many modes of clinical practice. It allows international career options, and then expanding horizon of the practice is going on expanding over the years. And so there will always be newer vistas of practice that will open, which may be of interest to those who think of this one as a possible career. So thank you so much.
Sure. Thank you so much, ma'am.
Yeah.
We now move to the next speaker of the day. We would like to invite Dr. Shilpa HD, and she would be talking. She is the professor and the head of department for Department of Biochemistry at CD Cymer. This is the medical institution as well as the research, the medical as well as the research institution of Dayan Sagar University. Over to you, ma'am.
Thank you very much, Mr. Shinde. A very good morning to all the dignitaries and warm welcome to all the students. Can I have my slides,
Yes,
Mr. Shinde?
Yes, ma'am. Just a minute, I'll just.
Sure. So today I'll be speaking mainly about the career opportunities of the course called Medical Laboratory Technician. It is a very important but yet a little less known course, having a wide variety of career opportunities. Now, the basic structure of the course, I think Dr. Pushpa Madam has already told about in her talk. So mainly in my talk, I will be concentrating on the career opportunities and why you should take up a course in medical laboratory technology. Okay, we shall start. The next slide, please. Yeah, what is this, or what do you study in a MLT course? As the name itself suggests, it is a medical laboratory technician course. It has its basis in science, that is chemistry, physiology, biology, and it deals with the overall diagnostic testing process. When I mean diagnostic testing process, there are a number of things involved, and all the students taking up this course will be trained in all these processes in the basic undergraduate program itself. Okay, so what are those diagnostic processes which are involved in detection, diagnosis, and treatment of a disease? It starts from a simple collection of specimen. It may be blood, it may be other body fluids. It's separation, it's analyzing and testing, more commonly with autoanalyzers. Reporting, how do you report a test, how do you issue a result, maintaining data, quality assurance, which is very, very important nowadays with the evolution of automation in our medical diagnostic industry, and also supervising. You will also be trained a little bit in the supervisory roles. Okay, so all this you will be taught in an MLT course. The next slide, please. Yeah. Why do you have to choose an MLT? First, let me tell you the value of this course. See, medical laboratory technicians are a very integral part of the foundation of the healthcare system. Okay, they play a very, very pivotal role because 70 to 80% of the diagnosis depends on our investigation reports. Not only diagnosis, even when a patient is given some treatment, how the patient is responding to the treatment is also based on a lot of diagnostic processes. So it has a very, very high impact in the healthcare sector. Next is the work atmosphere. Even though you will not be involved in or very less involvement in direct patient interactions, you will be working in a less chaotic atmosphere, which is mostly calm and peaceful. You will have excellent employment opportunities, a stable career which is very secure, and quick job opportunities. If you're not the one who would actually look into higher education and would want to settle with a basic undergraduate degree, there are a lot of entry-level jobs, so you'll have a quick job opportunity as well, and you will have a wide platter of career opportunities, which I will be briefing in my next slides. And it is one of the careers. I will show you a graph in my next slide with the growth rate of this MLT job opportunities. It is one of the careers with highest growth rate globally as well as nationally, also with a very high demand and very, very competitive salaries nowadays. Next slide, please. Yeah, see, this is the growth rate of the jobs for a medical laboratory technician. You can see actually here, it is almost up to 30%. Okay, and it grows at an average rate of 15% every year in almost every country. And other industries, it's only 11%. So by the year 2022 itself, the growth is expected to be the job opportunities growth in medical laboratory technician for an MLT technician or for an MLT student is expected to go up to 30%. It is that high. Next slide, please. Yeah, so I'll be just talking about a little bit specialty areas. When I mean specialty areas, again, you could go for a higher education in these areas, or you could also expertise with your experience with your undergraduate degree itself in these areas after finishing your course, and then you can specialize in these areas. Clinical chemistry with the basic clinical chemistry investigations or diagnostics like blood sugar, urea, cholesterol, and beyond. Hematology deals with your pathology part of it. Histopathology, where you will be doing processing the biopsy specimens mainly. transfusion services, where you will be working in the blood banks or blood centers, clinical immunology and clinical microbiology, where you will be dealing with the microbiological aspects like cultures and serology part, and molecular diagnostics. With the advent of COVID, now PCR is found everywhere. So you will have, if you have experience in, or if you want to experience in molecular diagnostics, you can choose that as well. Phlebotomy means sample collection. Now with this virtual labs or with home collection, you can expertise only in phlebotomy, sample collection, and you can stick on to that. Quality management systems, audits and accreditation, a very, very important and an emerging field for an MLT technician to specialize in. Every lab will have to now is going on for accreditation, that is the NABL accreditation and other accreditations. So you can specialize in maintaining the quality management systems of that lab and be appointed as a quality manager and things like that. Laboratory information system analyst, that is the software part of it. See, now nobody gives handwritten reports, isn't it? You would have seen whenever you go to a lab, you will be getting the report, which is a computer generated report through your SMS or in an email. So that is not as simple as it seems to be. There is a whole system called the LIS, and then you can specialize in that and you can contribute to maintain it or even design it by specializing in an LIS system course. Of course, drug testing, toxicology and forensic science are other branch outs for this MLT. After finishing your basic undergraduate courses, you can also take up this drug testing and toxicology and forensic science in their respective laboratories and get experience, and you can stick on to that field as well. Next slide. Yeah. Now, what are the possible career opportunities after finishing your MLT course? You'll have a very challenging and wide career opportunities both in the government sector and private sector. I have listed out a few a few areas where you can choose your career. Okay, the first one would be, of course, in the clinical or medical laboratories, either standalone or attached to a hospital. Okay, so now many laboratories are there which are not attached to the hospitals. You can work there as an MLT technician, and you can also work in the blood center or blood bank, okay, as a transfusion medicine specialist or a technician there. You can work in the pharmaceutical labs like a scientist or in drug testing things, and you have a very, very good opportunity in multinational companies which are involved in diagnostic. Now, this is a little less known fact for most of the MLT course students. Now, abroad, they use the term medical laboratory scientist. Okay, so that would be more appropriate because not only as a technician, but you can work as a scientist as well. We have a lot of companies supplying reagents and who supply us equipments, multinational companies. You can be appointed there as an application specialist or an application scientist, and in the research and development wing of those multinational companies which manufacture, and many of the companies which we are involved, we have a lab in our own institute, and most of them who come as application specialists like Biorad, Beckman, they are all having basic degree in MLT. Okay, so you have a very good career opportunity in multinational companies as well. And if you are a little bit you want a peaceful job, then you can select labs in medical colleges, as in I say a student's lab. We have experiments for students also, like first year MBBS students learn anatomy, physiology, biochemistry. The second year they'll be learning pathology. Now each of these will have labs. We will need you people, the MLT student or a person who has finished MLT in such labs, student associated labs also in medical colleges. You will have an opportunity in dairy industries and also water testing industries to test the microbiological standards and other things. Next slide, please. Yeah, as I already mentioned, you can work as an LIS and a data analyst because most of the labs are going digital nowadays. You have to get some experience in a lab as a data analyst or an LIS analyst, and you can continue your work in that field. Also in manufacturing labs, vaccine manufacturing labs and companies. If you're interested in teaching or academic programs, then you can pursue your higher education. You can do a master's, MSc in MLT, and also a PhD, and then you can become, you can come into the academia as a teacher or a professor. Yes, research is another field which is actually open to y'all as well. And this I emphasize because when we start this BSc MLT course in our own college, DSU at CD Cymer, we would definitely give research opportunities to BSc MLT students also, whoever is interested. Okay, so you can take up a post in research organizations, and during your internship, if you are interested in research, your college will definitely provide you the opportunity to get involved in small research programs. You have wide variety of chances in industries as well. As I've already told, apart from multinational companies, you can go into quality assurance. You have to do a certificate course for that, or you can get experience by working 3 to 5 years in a lab under quality assurance department. You can become an independent quality assurance consultant also. You can go into sales. You can become a scientific writer. Now, what is scientific writer? Most of the reagents we get something called a kit insert, which briefly describes the test and related things. So you can become a scientific writer in a company, research and development, and you can be a part of occupational health resource in big industries, okay, commercial industries also. Can I have the next slide, please? Yeah, higher education. Now, what if you want to go a little ambitious, you're a little ambitious and you want to take up a higher education? You can do, after BSc MLT, you can do a master's, MSc MLT, you can do PhD, and there are a lot of advanced postgraduate diploma courses in various fields, as I told, in quality assurance, in health administration, and in health management systems. So there are various postgraduate diploma courses, certificate courses. You can also take up supervisory roles if you do a lot of these certificate courses, like a quality manager or a hospital outreach coordinator. There are so many supervisory roles if you take up a certificate course. Apart from that, if you can do MSc and PhD also, and you can go into the academia. Okay, so there are a lot of higher education opportunities, not only related to the technical part, but also to the supervisory and administrative parts also. You can pursue a higher education degree after doing an MLT course, basic undergraduate MLT course. Next slide, please. So if you look at this MLT course, why I have put this slide, there are opportunities in various directions. You need not necessarily be a technician. You can become a scientist. You can become a researcher. You can join a multinational company. So you have seen some of the various opportunities what you have in basically every direction after you do a basic MLT course. So that is a versatile work opportunities, career opportunities you all will be having after doing an MLT course. Next slide, please. Yes, I have put this slide because nowadays doctors are known as heroes, but I would tell doctors need heroes too, and that is you all. That is allied health personnel. We need allied health personnel, MLT, physiotherapy, to support us, to support the doctors in our in giving the best care to the patient. So I would welcome more and more students to explore more in these MLT courses, and more students should take it up, because the choices are literally versatile, and the lab, the medical profession needs you all. Okay, thank you very much. I hope more students explore this and take up this opportunity. Thank you very much.
Thank you so much, Dr. Shilpa. We really appreciate your time and the guidance that you have given to students. It's always a pleasure to have the practicing folks to come and share their thoughts. We now move to the last speaker of the day. Sorry, we now move to the next speaker of the day, speaker number 5. We have Dr. Uma Shankar, And Dr. Umashankar will talk about careers in public health. Dr. Umashankar, over to you. Do you want me to share your presentation?
Good morning. Thank you, Mr. Shinde. I will share it from my side.
Right, sir. I'll stop sharing from my side. Yes, sir.
Yeah, can I go ahead?
Please go ahead.
Is the screen visible?
Yes.
Yeah. Good morning, all the members, the co-panelists, and my dear students. I would like to take this opportunity to thank the organizers for inviting me to speak on the careers in allied health sciences and the way forward. I'll be talking on the topic careers in public health. So in the next 8 minutes or so, we will be learning what is public health, because most of them don't know what is public health. It's a very upcoming field. And what are the functions of any public health professionals? What are the courses available for the public health professionals to do? And what are the few opportunities? There are n number of opportunities. I would say hundreds and thousands of opportunities available, but I would be just putting few for just as an example. So what is public health? Working in public health is actually a multidisciplinary subject or a system. Working in public health means you're trying to improve the health of the population. You're trying to prevent illness, to make a real difference in the people's life. That is what we do in public health. Just to give you an example, what has happened to our life expectancy? Life expectancy has improved remarkably. You see, from earlier days to today, what we are, our life expectancy has increased. Just for an example, maybe in 1980s, our life expectancy was around 55 or so. And today we are about 70 years, we are living more. And some of the developing countries' population are living even more. These all are attributed to the public health activities which has been done by various. And the public health measures, whatever we are doing is not new. It's been around for centuries. Thousands of years ago, it has been there. For example, the sewage system which was created, which was done by the Indus Valley civilization, brought down a lot of infectious disease. It reduced and they were able to manage a lot. Just a simple activity of having a closed sewage system. Even during those 2000, 3000 years ago when they did, it brought down a lot of diseases of managing the sewer and the waste management. That's how is the strength of public health. So public health is becoming a large, increasingly central area in healthcare practice today because of, thanks to COVID, people have started understanding the importance of public health. There's a huge demand for public health workforce, and there's a lot of career opportunities have increased over the last 1 year period. So we are talking about public health. What is public health? Public health is a science and art of preventing disease, prolonging life, and promoting health through an organized effort by informed choices by the society, by the organization, by the governments, by the community, and the individuals. So we are working for prevention of disease, prolonging of life, and promotion of health. So we have a public health approach. So what do we do in public health? I just want to give you an example. Just imagine that you have gone for a picnic somewhere in the seashore or in the river where you are enjoying your picnic, and then suddenly you see somebody drowning. And what would you do? Your first impact, what would you do is you just go jump in water and try to save, or you would throw something so that people can save. And suddenly you see one more person, then again another person, you go on doing. So what you do at that particular moment is mostly what is done in the medical profession. So what we do as a public health person, we call it as an upstream approach. So what do we do is, if it is going on continuously happening, we think, why are people falling? What is it that why are so many people falling in this? So we do is we go upstream and try to find out what is the problem, where does it begin. Then we try to find out how we can prevent these kind of incidences, or what can be done there. So we, once we go upstream and see, maybe we see that there is no barricade over there, people go to the cliff and they try to see from above and then they fall. So that could be the reason. So public health approach would be, we would put a barricade over there so that people do not fall, so that we can prevent more people from falling in the river and then losing their life. That's the public health approach. Just to give you our day-to-day example of what we do in public health. Suppose there's an accident. What would the medical approach would be? Medical approach would be that you give the treatment. If there's any fracture or something, you provide a treatment and take care. What would be the public health approach? What we do? We go and find out, why did the accident occur? How did it occur? What is the reason? Can we prevent it further in the future? So we will check whether the person had any vision problem, or he has some other health issues or something, whether he was an influence of any alcohol or drugs, or he did not follow any rules, or did he break any rules? Was there any traffic police there? Was the road good? Was there, do they, even if they have an accident, so that do they have access to healthcare immediately, so that their life can be saved? And whether people follow road safety. If not road safety, we will create some road safety rules and all those things, and we create awareness to the people so that they follow the road safe rules and guidelines, and then we can prevent accidents in future. This is what we try to do in public health. We, it is not only providing treatment, we try to look at various gamut of things and try to provide solution. There are a lot of people involved, what we call it as determinants of health or the disease. What are the reasons? We try to address those reasons and try to prevent the disease. Okay, so that's why it is said that public health is a discipline that aims to keep our population safe from illness, unlike doctors who treat individual patients. So we as a public health professionals, or when you join in the public health, you will be taking care of the entire community rather than individual patients. So what do we do in our service? There are a lot of activities what we do: assessment, policy development, and assurance. The Institute of Medicine came out with 3 core functional areas of these 3, and we have other services what we do. We monitor people's health, we diagnose and investigate what is the problem and try to find out a solution for that. We educate people, we empower people, we mobilize the community to take care of themselves. We develop policies for the government, we educate people about that, and we also help in enforcing laws. All these are evidence-based laws what we do. We link various services, not only that, what we spoke about earlier, medical lab technology or physiotherapy or anything. The public health professional link all of them together. We provide a complete competent workforce for the community, for the world, to the globe. And we also try to evaluate whatever the programs we have done, or the national programs what we are doing is working out well or no. Okay, so that is about public health. So it's such a wonderful area what we are going to step in. Now, what if we have to step into this wonderful area? What opportunities or what are the courses we have? So there are a lot of courses in bachelor's degrees in public health. You have master degrees. Bachelor degree in public health is a 4 years course, which is internationally recognized, and people are doing very good after their bachelor's degree. Then we have masters. If you want to do masters, you can go and do. There are a lot of specializations in masters in public health. It is one of the most sought about course over the globe, across the globe. Masters in public health degree, people want to do masters in public health because it makes them think differently. It widens their horizon, it widens their opportunities. So a lot of people uh, post their any degrees like medical, nursing, physiotherapy, lab technology and all, they come to do the master's degree in public health. As it's a multidisciplinary course, people from various domains come in. People from law, people from economics, business, all try to do this course, so that because all these different multidisciplinary background is required for improving the health of the community. After masters, you can do either doctoral PhDs or postdoctoral degrees in public health. You have a lot of opportunities in India and abroad. Then there are many certificate programs in public health. As each of the multidisciplinary subject, what are there? There are even some specialized certificate programs in this domain area. Now, public health practitioners work in various levels. There is, as I said, the horizon is bigger. You have n number of opportunities. You can work in the local communities, local organizations, small companies, district level, at the state level or a district level. You can be as a program officers, or you can work as consultants. You will be advisors to the government. Then you work in the national and international organization. There are a lot of national organizations, or you can work in the government programs, national health programs of the government, and international organizations like WHO, UNICEF, or USAID, or like that. There are many international organizations who are working in various fields of public health or disaster management, whatever it may be like that. Then you can work in government and non-government organizations, which at both national and international level. You can work in private companies. There are a lot of opportunities for public health professionals in private companies, as it also depends on what kind of specializations you are taking in. Corporate companies, now CSR is big activities in every corporate. So you can manage the entire CSR programs or develop programs and then manage them. Next, you can join any research. There is a lot of research activity which is going on. As earlier people spoke about COVID and the research and all, there are a lot of public health professionals involved in these research. Now today we know that there's so much of demand for public health professionals, epidemiologists, program managers. We need somebody to manage, because this is an epidemic which is happening, and the pandemic which is going on. You need somebody to lead and take it forward. So it is the public health professionals who can lead this and take forward and manage the situation. And you can join any educational institutions as professors or as faculty members and do research and teaching as well. So some of the career opportunities where our people are working, and the kind of opportunities you have both in India and abroad is you join as an, if you have completed your bachelor's, you join as an entry level. And if you have completed a master's, you go at the mid leadership level and then go on further. So you can start anywhere between the program officers, managers, directors, CEOs, and CSR officials or something like that. There are other opportunities like epidemiologists. Today in the country, we have shortage of epidemiologists. We need epidemiologists. There is dearth of epidemiology. Biostatisticians. You can join in biostatisticians. That's one of the highly paid jobs now, epidemiologists and biostatistician. Not only you can join in public health, you can join in any research organizations if you are an epidemiologist or a biostatistician. Disaster management, never ending area. So it's a lot of work in disaster management. There's a lot of job opportunities in disaster management. There also you specialize in that. Then a lot of factories are employing public health professionals as occupational health managers. You can manage the health of the employees or something. Communicable and non-communicable disease specialists, you have opportunities are just growing. Big social and behavioral scientists with a lot of lifestyle diseases. We have a lot of opportunity in social and behavioral scientists, because behavior makes a very important determinant in our life, and that is one of the reasons where most of the lifestyle diseases are happening. Then community health educators, you educate the community. Program and policy planners, you advise governments, you advise institutions, you advise various research organizations on various policies and all. Or you can go and join as an academicians or researchers in these. So these are the opportunities after you join public health education. Actually, I've just listed few. There are hundreds of like this opportunities. You can start your own NGOs, you can work in companies, or you can partner with somebody and then work. You can be as an individual consultants, so it's just the sky is the limit for public health once you complete your public health course. So in conclusion, I would like to say that what sets public health practitioner apart is the passion and the desire to improve the health and well-being of the population. That is very important, which will reduce the inequalities in the community and improve the health. To be very honest, the public health career would give you a very challenging field. It's a very challenging field. It is a very rewarding field, and it's very satisfying. Believe me, you have full satisfaction once you are in this field. So thank you. And I would hope uh, all of you all, whoever is interested in community health or in public health, would join the public health course and do a lot of service to the humankind and uh, get satisfaction to your fullest essence. Thank you. Open for any questions later.
Thank you so much, Dr. Umashankar. We have instructed the students that they could put in their queries through the chat to us, and we will be able to take this up one by one once all the speakers have finished with their part of the presentations. We will now move on to the next speaker. This is the last speaker of the day, Dr. Prashant Kumar. Dr. Prashant Kumar, are you there?
Yes, sir. Very much. I'm here.
Right. Do you want me to make the presentation from for your slides?
I would do it from my side, sir, if you don't mind.
Sure, sir. I'll just do this. I'll just stop the screen sharing and hand it over to you.
Yes, please.
Yes, sir. Over to you. This is a Word file.
No, I think I got the wrong one. I'll just say.
Right.
Or you go ahead, sir. You share it from your side.
Right, sir. You can just do. You can just stop the screen sharing. I'll do it.
I will do that.
Just a second. I'll put in the screen. Yes, sir. Please go ahead.
Good morning to one and all. On this very day, I welcome all of you to this talk. So far, the speakers have highlighted to you about the allied sciences, the scope of it, and the various courses. I've been given the privilege of letting you know about doing it specifically in the CD Cymer, that is the Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research. How would it be? Being one of the earliest faculty member to have been employed here and working from almost day one of this institution, I have the privilege to let you know briefly about the institution itself, so that you get to know how would it be. Can I have the next slide, please?
Yes, sir.
Now, this institution is so new, you might not have heard about it. It's a very huge, sprawling campus across 140 acres of land. It's got a wonderful college building and a hospital, which is of the state of the art. It's about 1,350 bed. That's totally planned, and about half of that is now complete. It lies on the Kanakpura Road at a place near Arohalli, and it is built so beautifully with a Greco-Roman architecture that anyone would be excused to have mistaken to be in Europe when they come to the campus. It's wonderful. Such an ambience provided at the university campus, it makes it feel very, very special. And you know that in the corporate world these days, the ambience is given so much importance, and that's been taken care of in this particular campus. It encourages creativity. It stimulates innovation and motivates scholarly pursuits of any course the student joins in with. It is built with a great vision by the management to revolutionize the nature of medicine, science, society for the national and global welfare. Now, if it is built with such a noble outlook, it would be needless to say, but still it's my personal duty to stress that it's not just this building, it's the people there who make it very special. Pain has been taken to select the very best faculty members amongst the people who, across the state, and needless to say, even across the nation. When this institution started 2 years back, it was advertised widely, and the administration people and also the management have taken pains to select the very best people. How is it important? Our earlier speakers told you that the courses which are being talked about are all about skill development. So I'll be showing you images of these laboratories. It's not just the infrastructure and the building and the people, but all the labs are ultra modern. Their layout, the way the ambience is laid out in the interiors of these labs, spaciously, without overcrowding. If you look into the pandemic, a lot of stress has always been laid upon wide social distance maintaining. And even before any such thing happened, we had the vision of creating these labs with all these norms inside. Here in this image, you are seeing the hematology and a pathology lab, where majority of the lab work of training of students is done. And on the right side is the clinical physiology lab, where the students are taught briefly on how to examine a patient. And this particular clinical lab, the students do get to examine themselves as normal subjects, so that when they go to the hospital, they get a feel of what is different with a patient, what is different that they can do something about. Can I have the next slide, please? And we have, needless to say, one of the best anatomy museums, because it's very, very important. Pushpa Sarkar madam in a talk was stressing upon how a student should know the normal anatomy first, the normal structures within the body. And this anatomy museum is a wonderfully designed, let's say state of the art again, one of the best in the campus. And the histopathology lab on the left side, that also is a lab which highlights how exactly tissues are taken out, and compared to normal tissues, how the pathology or the abnormality in the tissues can be made out and differentiated and highlighted. So you can actually by now get the sense of feeling of euphoria, the grandness of this campus, where you would want to do this course. First thing, you already had enough motivation from all the speakers so far to take up these courses, which are, let's say, a silver bullet, because it's so short for 4 years, and immediately after that you can get into the career. You need not have needless waits of years together to do some post-graduation. These courses get you beautiful skills which are life-scaling, and in this pandemic era, everyone has learned the importance of medical field. We are now, I'm very sure, a lot of youngsters egging to go and become the best in medical field. And these are short courses which get you straight into the field so that you can start helping people. So now let's talk about the last slide of my presentation. I was told to speak about the Bachelor of Science in Anesthesia and the Operation Theatre Technology. Now you might wonder what the student of this course would be doing. You all must have heard that every medical college will offer all the specialties. And there are surgical specialties like the general surgery itself, where vast majority of the abdominal ailments are handled with. Then we have ENT, ear, nose, throat surgeries are done. Then it also has come into limelight now with the mucormycosis spreading among the patients of COVID, how debridement and early installation treatment can be life-saving. So that's another challenging surgical field. Similarly, we have ophthalmology, where surgery is done into the eye to correct various ailments of the eye. Then we have orthopedics, wherein the bone surgeries are attempted, and this will come into this hospital for treatment of orthopedics. And the hospital itself has wonderful operation theater courses with the state-of-the-art facilities. There are 2 huge complexes of multiple operation theaters, and these operation theaters cater to very good crowd, huge crowd from Ramnagar district. This should be the pearl or the crown of the medical field. Hospitals dotting the entire district, they all come here. And from day one, this hospital has attracted more than 500 patients per day. Now, this particular course prepares the student for a very challenging career in hospital, nursing homes, trauma care centers, emergency care centers, intensive care units, coronary care units. Why? Because from day one, the students, once they familiarize themselves with the normal anatomy, physiology of the human body, they are taken into the operation theaters and they are trained on how the equipment there are to be kept ready for the surgeon to come and operate. It is these background help that these students will provide makes the surgeon's task that much easier. With a very proper background being provided with the equipment, with the infrastructure, with the lights, the student learns to make life of a surgeon easy. Now, once this career is done, what are the future prospects for these students? Once they are doing that, both in the domestic field and in the overseas field, there are huge number of employment opportunities, also in research and manufacturing units of medical equipment, because these students will have learned about the physics and how these equipment come into play. How can these be improvised is a huge challenge, and medical equipment manufacturers might in future look for these students to be employed also. So not only are the career opportunities just in hospitals, nursing homes, emergency centers, intensive care and coronary care units, but also in research and manufacturing units of medical equipment. I foresee that this could be a very true happening in the very near future. So this is a good career to embark upon. No doubt, students, I think you should all be very enthused after my talk about the place, the Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research, and the Dayanand Sagar Deemed University, where you can take up this career. I would sit with other speakers and take any questions in future, and I hope I've brought the interest to the fore amongst all of you. Thank you.
Thank you. Thank you so much. Thank you so much, sir. It was a pleasure listening to you. We would now like to invite the students to come in to put in their queries so that all the speakers are available. We can take them one by one, and we can help out in terms of any kind of queries that come in from the students related to the program, related to the duration, related to the internships, any of those kind of activities. Please let us know. The forum is made available wherein you can chat and put in your queries.
It's not just about classroom training, but it's also about industry-ready placement training.
I have been placed in a very reputed company from Japan with the highest package. I'm looking forward for a successful international career right after college.
Registrations for admission to Dayananda Sagar University is now open. For more information, visit www.dsu.edu.in.
Yes, students, if you all have any queries, please share it on the chat, and we shall be able to take up those queries. Okay, we have one query. Of course, we have a couple of them coming in. I would raise the questions, and I would request the respective speakers to look into this. The first question is, how about the scope in cardiac technology, sir? Who would like to take this up from the speakers?
I won't mind answering this question.
Please,
Dr.
please, sir.
Prashant here.
Yes, sir.
Students who are taken into the cath lab and also into the various fields of cardiology where treatment is offered, and they are trained on how to help the cardiologist do an echocardiogram or to look into angiocardiography or angioplasty. And these are technologies which are taught to the students in this particular field. It has a vast scope. As we know, after this pandemic, India is investing heavily into building up infrastructure in the healthcare field. So this would be really good to take up.
Okay, there's another question. Does CD-SIMR have lateral entry for BMLT programs?
This is Dr. Pushpa Sarkar.
Yes, ma'am.
I would like to answer this question. The lateral entry is usually for the second year of this bachelor's course. Now, since we are starting these courses in this academic year in 2021, so the students are coming to the second year only next year. So the lateral entry is available from 22 onwards.
Okay. There's another question. I had the similar question a couple of days back also. Sir, I really want to know that is our college having any tie-ups with international universities so that the student can take up internship or master's degree outside India?
Once again, Dr. Pushpa Sarkar here.
Yes, ma'am.
Now we are starting these courses this year, and when the medical college has been functioning from this year onwards, we are at it. In fact, we are looking at it with Health Education England and also certain universities elsewhere in Ireland too. So one in Austria has also come forward. So we are at it. We are working on that. So by the time these students come to the final year, by then we'll be having a robust MOU, and we can offer this particular internship or training abroad too, in a student exchange program or in the internship, and even where they can go, learn, earn, and return. This is a policy of most of the foreign universities where they employ them for a particular period. So either you can continue there or you can learn, and you can also earn during the internship and also return to render your services here. Thank you.
Right, ma'am. There's another question. What are the specialties available in AHS, Allied Health Sciences? What are the specialties available?
As of now, this particular year in 2021, we are open to bachelors in medical laboratory technology. As Dr. Shilpa was mentioning, this has got the highest requirement as of now in the job fields too. And we have BSc in emergency and trauma care technology. And I think the students can see what's the importance of this as of now too, because most of the doctors now attending to COVID patients, there are so many other emergencies and other regular patients who are at the hospital to be treated too. And in the emergency ward, you see patients just coming into the emergency ward, and it would be great for these students to assist there in the casualty department. And if taken up, they could even start the treatment also for the initial treatment for the patients coming in. That's emergency and trauma care technology. And the third one is the BSc anesthesia and operation theater technology, which Dr. Prashant was talking about. Then we also are offering medical imaging and radiology technology. Now this is also in the forefront now, medical imaging radiology technology, where you have in detail about the machine learning here, how to use an X-ray machines, various X-ray machines, the CT scan and the MRI, the regular ultrasound scanning, all these procedures. And as you know, once again, the reports are generated by the technicians these days because of the, so much of burden, patients rushing in to get this all scans done. And the reports are generated by technicians, and doctors usually they opine on that, and in certain cases they would also recheck certain times. But technicians play a very important role here, and this would also involve treatment also in this particular course, where they give radiotherapy to the patients for the mainly intended for the cancer patients. Even that is involved here. So this also offered this year, medical imaging and radiology technology. Then the other one is, the fifth one is the BSc renal dialysis technology, what I had spoken one or two words about, where, as you know, once again, the load is too high. There's so many renal dialysis centers, individual centers open, and some of them, as the social responsibilities, they have come forward to open this dialysis centers. The Rotary Club, the Lions Club, they're also opening these dialysis centers to cater to the need of the patients. And there is a wide demand for this renal dialysis technicians. Now, certain times they can even give this tender to patients at home who are immobilized, who cannot come over, and they also could take the help of these particular technicians. So we are starting this BSc renal dialysis technology also. And the last one is Masters in Public Health. Now this, in fact, we're not starting with the bachelors here. There's only Masters in Public Health, where this is open for the graduates. That's it. Thank you so much.
Sure. Yeah. There's another question coming in from a gentleman from Calcutta. Good morning to all the respected speakers. Any integrated PhD program is available at DSU University?
Yes. As far as I know, it is available, where a multidisciplinary, if is asking for, or integrated, it all depends on the specialty what they have done. Usually these PhDs are offered as per the UGC rules after the post-graduation.
Sure.
So if there's a related field to their postgraduate degree, definitely is offered by DSU in
Sure,
all the various fields. Yes.
A Masters and PhD is integrated question there.
Right, sir. Right, sir. What is the scope of physiology in India?
Physiology?
Yeah.
Yeah. I think Dr. Prashant will take this question.
Yeah. Actually, if the question was meant as physiotherapy, maybe Dr. Savita can add points after that. But physiology, apart from being a part of the medical and paramedical courses, can be taken as a PhD also, and MD, the Doctor of Medicine in Physiology. And there is a lot of scope in medical colleges as teachers, and to do various other further courses of specialization like neurophysiology and endocrine physiology, immunology. These are the fields. But if it is meant to be asking about physiotherapy, maybe Dr. Savita will add a few things for this.
If the student was looking for some kind of information on the scope of physiotherapy in India, as I had mentioned in the presentation, at this point in time, the scope is quite wide. As I said, that one can, most, or I would say more than 60% of students who graduate with a bachelor's degree or a master's move into clinical practice, and clinical practice could be in various settings. They can set up their own clinic, or they may join large hospitals, rehab centers, sports centers. Another very evolving area is home care service projects that people are opening up, where you deliver care at home. A lot of physiotherapy professionals are part of such teams. So the scope is tremendous in clinical practice. The opportunities to work beyond the shores is also there, but every country has its own licensing requirements. So then, and most countries today beyond India will take an individual with a master's degree. An entry-level bachelor's in most countries, they request you to do a master's either at their home country or in your own country, and then apply for a licensing exam. So clinical practice-wise, there is a lot and beyond in terms of even work and scope available for individuals who decide to graduate with a bachelor's degree in physiotherapy.
Sure, ma'am. Thank you so much. There's another question related to physiotherapy. Is it good if we do the MPT in sports abroad, or do we do it in India? What are the job opportunities if we do the MPT abroad and then look out for jobs in India?
A pure specialization of masters in sports sciences is something that has become more prevalent in India maybe in the last 5 years. Earlier to that, it was always clubbed as a masters of orthopedics and sports. So that itself tells you that the position of having a master's in sports science as an entity is now being recognized. Up until now, a lot of people would take up a master's program in sports science, either from Australia or from United Kingdom, and then come back to India and look for positions with sports teams. But that is now, I'm not saying it's not prevalent, but the Indian Masters in Sports Science is equally accepted and recognized. Because of India moving into something called league games like the IPL or the football leagues or the tennis leagues and the badminton leagues, every single, franchise has its own set of dedicated physios employed with a sports background. And the off season, they work with the players for their wellness, their fitness, and I would call it off season training. And during season, they travel with the team. So the job opportunities for sports science in the last 5 years, since a lot of the leagues have commenced, has grown exponentially to more than double or triple of the job opportunities for sports earlier. Earlier, it used to be more with sports authorities of India or a local club, but today it's across the board, be it a Kabaddi league or any of this. So yes, Indian masters in sports science are equally recruited for the positions that they will take up within the private franchises.
Right, ma'am. Thank you so much. The next question is, are the allied health sciences people being recognized widely in India? I think Dr. Pushpa Sarkar could handle this.
Yeah. Thank you, Shindy. Now, this is what we are talking about for quite some time. And of course, they are recognized. As of now, as I said, they may not be regulated or registered with a particular body, but they are recognized across India. You find so many of them working in various industries, and the need is so much now, and definitely the employment areas are wide, and of course it is a need of the healthcare sector as of today. We're seeing it with your own eyes. You're seeing it. We require more and more technicians. You must be knowing the PCR reports when you go in for a COVID testing. The number of reports, the number of patients being done, it's delayed. Had we more number of technicians attending to this, there might have been more organizations also, more laboratories serving. So the results have been quicker and catering to more number of patients. So the need of the hour now is the allied healthcare professionals to strengthen the team of the medical system.
Right, ma'am.
Since there is a commission now from the government of India, and there'll be a state council within 6 months which will be formed, and there'll be a body to regulate. And as I told you earlier, these candidates will be registered. So there'll be a registered healthcare professionals.
Right, ma'am. Ma'am, are you there? Ma'am, are you there? Yeah, we have the next question.
Yeah, go ahead, Shinde.
Yes, sir. I think ma'am has put it on mute. Madam has put it on mute. Dr. Pushpa Sarkar.
Yeah.
I think your side was on mute. There's another question. How different is health science from life science?
No. They're one and the same actually. The allied health sciences are nothing but the health sciences. They have just segregated it from medicine has got its own regulatory body. Medicine is also a health science. When you say allied is along with, together with, in association with. So they took it as a mainstream medicine, as a mainstream of medicine. And these are the courses later developed along with the medical course. They're nothing but health courses, the health sciences. The allied health courses are nothing but health sciences.
Yeah, there's another question. What kind of scope can be seen for nursing in India? Is it better to do BSc nursing in India or abroad?
Yeah, BSc nursing in India, we have the Indian Nursing Council, a regulatory body, which has been time and again upgrading the nursing course, the guidelines and the regulations, and also the what shall I say, the syllabus and the mode of teaching, the practicality, the new courses into nursing, and making it a robust stream of healthcare. Nursing is also in healthcare. India is strong enough to prepare good quality nurses. And as of now, I do see so many of the nurses are employed abroad. There's a great demand of nurses across the globe. Even if you see US or UK being the world leaders, even they're not, there are not enough nurses there to tend to. Nursing professionals are not there. There's a high demand from them, and continuously there's a need for them. They're asking us to provide nurses to them. So there is a wide scope for nursing both in India and abroad. India is good enough to provide good nursing education. My only sincere request is to get educated in a premier institute. That's it.
Madam, there's another question here.
Yeah.
Can I join MSc in public health after BSc nursing?
Of course, sir. Because it is open to, sir, this public health, sir, we don't call it as an MSc course. It's called as Masters in Public Health. This particular nomenclature is by Government of India, sir. Ministry of Health, Government of India has put the guidelines as, yes, sir. Now, this course is open to MBBS, BDS, nursing, even to pharmacy also, sir.
The eligibility is a bachelor's degree, right?
No, sir, it is a master's degree. It's master's in
public health. The eligibility is a bachelor's degree.
Yes, the eligibility is a bachelor's
in any domain. In any domain.
In most of the domains, sir. In most of the domains.
Okay.
There's another question. What entrance exam do we need to give for physiotherapy course?
So as of now, we do not have any entrance exam as of now, sir. What the eligibility we have asked is English being the medium of teaching. They should have studied English in their +2, and also physics, chemistry, and biology is a must with scoring of 40% and above, sir. This is what we are looking for as of now to get an entry into the physiotherapies.
However, anybody is going to apply to physiotherapy, we normally have a brief interview with the concerned principal to check whether the orientation is there or not before we admit the candidate.
Right, sir. That's it, sir.
There's another question. Another question. What is the status of forensic science in India?
It's picking up, Shinde. This forensic science has just picked up because the earlier kind of things were far different. Now the forensics, digital forensic science has picked up in a big way. Earlier it used to be a regular forensic science. Now it's a digital forensic science which has taken over. I think a lot of work is going on. I'm sure there's plenty of scope for this area.
Okay. Is NEET required for AHS?
No.
Not required.
Pardon, Shinde?
Is NEET exams required to?
No. As of now, no. NEET exam is not required for allied health science courses. As Honorable Vice Chancellor was mentioning, we would screen the applications. We would screen the applications, and once again, we would have a talk with all the applicants, once again briefing them about the courses.
We would like to clearly tell them what is in store for them before taking up any course, so that we give a briefing, a orientation, prepare them for the course. That's what we normally do in Dayananda Sagar University. We don't, though a student is going to apply, the admission is offered only after talking to the student and having a briefing with the concerned principal or the faculty. Yes, Shinde.
Yeah. I think most of it has been done. The gentleman who is giving clarification for about psychology instead of physiology, he wanted to know more about the program on psychology and not physiology. I think we can email the details to the student in terms of the program which is offered for psychology.
Okay.
That's a different activity by itself. So I think these are mostly the main questions. There are people who are asking about the entrance test. What I suggest to the students is, please visit the Dayananda Sagar University website, which is www.dsu.edu.in. And I would request you to please fill in the applications. Once your applications are filled and once you select the options for the course, the corresponding e-brochures will be sent across to you. We will be having one of our counselors calling you, giving you all the details. And that's how you could look at the start of your admission process. There are many students who have already taken admissions with us. I do understand that examinations have been postponed, but there are students who are also available who are very clear in terms of what they need to do. Such students are already welcomed. In fact, many of them have already taken admissions. But students who are still awaiting or who would still want to decide, you can always come into our website, put in the details, and we'll have some of our career guidance experts talking to you. And regarding the DSET examinations, all the courses under engineering and MBA, MTech, M-Pharma, as well as B-Pharma, these courses, definitely students will have to write the DSET examinations. And once you fill in the respective details, you will be getting all the processes that are involved and to appear for the Dayananda Sagar entrance examination or aptitude test. So please visit our website and all the details will be made available to you once you register on the website.
Okay.
I think with this, most of the questions have been handled. I would like to thank all the speakers today who have given us this time to take this session, which is a very good career guidance opportunity for all the students looking at some of these latest programs. It gives a complete perspective in terms of kind of programs, kind of facilities, kind of labs, kind of job opportunities, kind of opportunities to go for higher studies. A big thanks to all the speakers, and we definitely would like to take this opportunity to thank all the students. We have students from Pan India who have currently logged in and have taken advantage in terms of understanding these programs under the Allied Health Sciences. For any more details, you could always ping us through the website, and we'll have some of our experts talking to you on a one-to-one basis, and which will be a more focused activity. If anybody would like to have the recording of these sessions, you could please email us. We have already shared the email IDs, or you can just go into the website of us and we have the email ID shared there, and we will have this link shared with all of you. So thank you one and all. It's a pleasure having spent this valuable 2.5 hours with all of you, and we look forward to seeing you soon for all these programs or some of these programs at our university.
Thank you.
Have a lovely day ahead
Yes.
and stay safe. Yes, sir.
Thank Imtiaz for providing us
Yes.
all the support.
A big thank to Mr. Imtiaz and to Mr. Ali for all the support being provided today for taking this session live. Thank you so much.
Thank you all the panelists. Thank you very much.
Thank you, Honorable Vice Chancellor, Mrs. Shinde, and all the
Thank you all for
co-speakers.
the
Thank you so
opportunity given.
much.
Thank you, sir. Thank you.
Thank you, sir. Bye-bye. See you.